Hey you guys, Ashley Chandler here to give you some introductory, somewhat boring information about cancer, just to get you ready for our 3 lecture series in your Select Populations course. So, cancer, you guys have gone over some of the nitty gritty pathoanatomical stuff about this earlier on in your didactic year. But cancer is a group of diseases characterized by the uncontrolled growth and spread of abnormal cells. And when that growth and spread is uncontrolled, death can be the result. So there's lots of different causes, lots of different treatments. There are external factors and internal factors to cancer. So external are those things that we have some effort of control over and choice in, such as tobacco use, some connections between infectious organisms like HPV, HIV, H. pylori can cause some gastric cancers or duodenal cancers, and also an unhealthy diet and obesity has been correlated to a lot of increase in risk of cancers of lots of different kinds. Internal factors are those things that we don't have control over, so they're kind of unchangeable. This can be anything from inherited genetic mutations, hormones, if it's a hormone mediated cancer cell, and immune conditions. So, there was one study in Johns Hopkins that found a connection between autoimmune diseases similar to RA and lupus and some forms of breast cancer. So, that's still an ongoing area of research. Treatments can be varied, so we're getting better at localizing and specializing treatments to the cancer and the specific kind of markers that each cancer has, so it's becoming more targeted. It can be surgery, radiation, chemotherapy. Those are the ones we normally think about. The newer ones that are coming with more research are the hormone based therapies, immune therapies, and targeted therapies. And these are all drugs that are interfering specifically with cancer cell growth and specifically with the markers on that individual patient's cancer cell and what it may respond to stop it from growing and letting that growth become uncontrolled, which is when health plummets and death can result. So, some facts about cancer: 20% of cancer is related to those external factors. So, those things that we have control over. Maybe it's excessive alcohol intake, poor nutrition, physical inactivity, things that we could change. So, there are studies that are showing that adults who follow healthy lifestyle recommendations, which include not smoking, following good nutritional guidelines, and being physically active, are 36% less likely to be diagnosed with cancer and 40% less likely to die from the disease if they do end up being diagnosed. So, those are some pretty good statistics to encourage us to get off our butts, get moving, and get healthy. And I use some of these statistics when I'm talking with patients, especially the second one of mortality, to get my cancer patients who have already been diagnosed and I'm seeing in therapy on board with some of the healthy lifestyle recommendations that I'm giving them. Some of these statistics can be pretty convincing to somebody to get going and get moving and motivated again. So, what are the recommendations from the cancer.org, which is a great place if you're looking for any statistics about cancer? There's no safe form of tobacco. None of them are safer than the other. They are all bad. They will all increase your risk of cancer. Maintain a healthy weight. So, many types of cancer will increase when overweight or obese, and mortality, like we just talked about, will also increase if you're overweight or obese. Stay active. The recommendation that you guys have all heard is 150 minutes of moderate intensity exercise weekly or 75 minutes of vigorous intensity exercise. 150 minutes of the moderate intensity is you're getting a bit breathless, but you can talk, you cannot sing. When it's vigorous, you can't talk very well when you're talking if you have working out with a partner. Eat healthy. So the recommendations are 2.5 cups of fruits and veggies daily. All those things that we know just as health conscious people: whole grain foods, moving away from processed foods, finding healthier sources of protein, and limiting our alcohol intake. All of those things will help to reduce the risk of cancer. So, cancer screening is something that is always changing with the literature. So, it's something we have to stay up to date with in our practice. But these are the current cancer recommendations that are out there. Starting as early as age 21 to 29. So, colon cancer can start to be screened in the ages of 21 to 29 if there's an increased risk. So, increased risk includes a family history, um, inflammatory bowel disease of the patient, and some other genetic disorders that will lead to that increase in colon cancer. High alcohol intake is something that may lead to them needing to be screened, and if they're physically inactive. And so that's a discussion they're having with their physician to decide, do they have enough of those risk factors that early screening can be merited. Cervical cancer is one for females. Pap smears in the ages of 21 to 29 should be completed every 3 years unless there's an abnormal finding. From age 30 to 39, colon cancer should continue screening related to the relative risk. So those same risk factors of when they're in their 20s. And cervical cancer, if you've not had an abnormal pap, then you can decrease that screening to every 5 years. Age 40 to 49, colon cancer, all people of average risk should begin screening at age 45 is the current recommendation. Prostate cancer at age 45, if you have a higher than average risk, which usually they will start to look at close family relations who have prostate cancer, then you should begin to open that discussion with your healthcare provider to see if that's something you should start being screened for. Breast cancer, it varies a little bit. General rule of thumb is that most people will start at age 40. What we're finding with the literature is ages 40 to 45, it's a woman's choice. Everyone should start yearly mammograms at age 45, no matter what. Cervical cancer in the 4th decade of our life should drop back to 3 years of a pap smear, unless there's any abnormal findings. So moving to age 50 to 64, lung cancer, if you are 55 and over and you have a history of smoking, then you can discuss with your healthcare provider if it's appropriate to get a low-dose CT scan yearly. So you can imagine the kind of hassle and the medical healthcare costs for CT scan. So that's a discussion with how are your risk factors and how likely is it that they might be finding an early stage of disease. Breast cancer in this time frame, the option is to reduce to every 2 years when you hit 55 for your mammograms, bumping from every year to every other year. If you look at greater than 65 years, colon cancer recommended testing until 75, and then 75 to 85 becomes a discussion with your healthcare provider to decide if that's something that is needed for you. After 85, there's no recommended screening for colon cancer. Cervical cancer, no longer needing screening for women if there's normal tests for the last 10 years when you're over 65 years of age. So getting into some cancer statistics here. So this is a nice demographic or little infographic, from the cancer.gov. It only goes up to 2014 was the latest statistic that was available. But from 1990 to 2014, the overall cancer death rate in the U.S. has fallen by 25%, and that continues to fall yearly. So I would expect probably if we had up-to-date statistics to 2018, that it would probably be even less than that. We are getting better and better at managing cancer. Even if they are in just a management, they are moving into the survivorship, and their lifelong expectation of survivorship is extending. So death rate is lowering. So in 2018, there will be an estimated 1.7 million new cases of cancer diagnosed in the U.S., and 600,000 people will die from cancer. The most common cancers in the U.S. are breast cancer, and then lung cancer, prostate cancer, colon and rectal cancer, bladder cancer, melanoma, and non-Hodgkin's lymphoma. So that 1.7 million diagnosed new cases of cancer does not count carcinomas in situ, which we'll talk about on day 2 of our lecture. So you'll be able to know what the difference is between that. So the number of new cancer cases per year is expected to rise to 23.6 million by 2030. So right now, 1.7 million new cases per year is expected to rise all the way up to 23.6 million a year. I think that's a pretty crazy statistic. The second leading cause of death in the U.S. is a malignant neoplasm. So it is something that is causing a fair amount of the causes of our death. 87% of cancer is diagnosed in those that are a bit older, so over 50 years old. Cancer mortality has lots of different factors, which we'll touch on some during our lectures together, but it's higher mortality in men than women. It's highest in African American men, and it's lowest in Asian or Pacific Islander women. So, 14.5 million people will be living beyond a cancer diagnosis in 2014. Again, that's the latest statistics that are out with that estimated survivorship data. It's expected to rise to nearly 19 million by 2024. So, in another 6 years, we're expected to have 19 million people in the US living beyond a diagnosis of cancer. So, in that survivorship phase of cancer. Nearly 40% of men and women will be diagnosed with cancer in their lifetimes. So think about your classmates and think about 40% of you guys in your lifetime, if statistics pan out, will be diagnosed with some form of cancer in your life. The 5 year survival rate of all cancers has improved 20% in the last 3 decades. 5 year survival rate for breast cancer is now 99%. There are some different mutations of breast cancer that don't have as great of survival rate, and we'll talk about those on day 2 of our lecture. But for most women who are diagnosed with breast cancer, they will not have that cause of death. They will have another cause of death, most commonly being cardiovascular, which is our #1 cause of death here in the US. So 5 out of 6 women diagnosed with breast cancer will die from another cause. So all of these statistics lead to there being a lot more survivors of cancer. And these survivors make their way into our PT clinics. So they may be coming in for something not at all related to the fact that they're a cancer survivor. And you just see that little checkbox on their past medical history when they come in to your clinic. So we need to know about their pathway through cancer treatment and how that's going to affect their health going forward, because it's going to affect some of the things that we're doing with them in the PT clinic, either if we're addressing directly some of the deficits from cancer treatment, or if we're addressing something completely different. How does that change our plan of care and our expectations?